I'm Dr. Prashanth B. Nirvani Rao. I'm a consultant gastrointestinal interventional endoscopist practicing at Chaitanya Gastrointestinal Care and Endoscopy Center, KR Extension, Tumkur. As we all know, 28th July is World Hepatitis Day, and the theme for this year is Time for Action. And what is hepatitis? So hepatitis is nothing but the inflammation of the liver. And what is inflammation? Inflammation is swelling that happens when tissues of the body are injured or infected. So hepatitis is caused by non-infectious agents and infectious agents. In non-infection agents like drugs, alcohol, chemicals, etc. will come. In infectious, it is mainly the virus. Today we are going to restrict our talk to viral hepatitis because this is the one which causes a lot of deaths. The World Health Organization study found that estimated 4.5 million premature deaths could be prevented in low and middle income countries by 2030 just by vaccination, diagnostic tests, medicines and educational campaigns. 90% of these mortalities usually occur only in two types of hepatitis, that is hepatitis B and hepatitis C. 3.4 million people are living with chronic hepatitis B and C in 2022. 1.3 million people died of chronic hepatitis B and C in 2022. Only 45% of the babies received hepatitis B vaccine within 24 hours of their birth. 2.2 million new infections because of hepatitis C and B every year. Nearly 220 million of hepatitis B is undiagnosed, and also 36 million of hepatitis C is undiagnosed. India is one of the countries with the highest burden of viral hepatitis. Viral hepatitis are of 5 types. They are hepatitis B, hepatitis C, hepatitis A, hepatitis D and hepatitis E. Hepatitis A is caused by hepatitis A virus, hepatitis B is caused by hepatitis B virus, hepatitis C is caused by hepatitis C virus, hepatitis D is caused by hepatitis D virus and hepatitis E is caused by E virus. In this, hepatitis B and C are known to cause chronic infections which can lead to further diseases like cirrhosis and maybe hepatocellular carcinoma. Now, hepatitis A and E is common in common causes like fecal-oral route contamination, or if the feces of the infected persons get infected in the water and the other person drinks the same, this can spread from person to person. Whereas hepatitis B and C has common causes like if the infected person's fluids or blood comes in contact with the normal individual, he can get these diseases. So it can be sexual contact with the infected person or sharing needles, syringes or drug abusers and during pregnancy and delivery. And mainly also injectables which can cause, and sometimes the blood products, unscreened blood products and blood can also cause this disease. There's another type called the hepatitis D, for which you need a pre-existing hepatitis B patient because this hepatitis D will survive only in hepatitis D patients, and this also spreads through blood and other body fluids. Hepatitis A and hepatitis B can be prevented by vaccination, and we have to educate people on taking the vaccination for these diseases to prevent, because hepatitis B doesn't have a specific treatment and it is still they're not cured, but hepatitis C can be cured. So the common symptoms of all the hepatitis can be jaundice, fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, sometimes joint pain. Urine will be dark. There can be clay-colored stools. Usually diarrhea is seen in hepatitis A virus, and flu-like syndrome are symptoms, and unexplained weight loss. There are some government initiatives in this program in India, like the National Viral Hepatitis Control Program, wherein the goal is to eradicate hepatitis by 2030. And also India's Universal Immunization Program, wherein hepatitis B vaccination is included free of cost. Some do's and don'ts. Take sufficient rest, eat a well-balanced diet as per doctor's advice, drink plenty of water, at least 6 to 8 glasses of water a day, avoid tobacco and drugs, wash your hands properly every time you go to sanitary and also after coming back from toilet. Cover open wounds, sores, cuts with a bandage. Discard used items carefully to prevent accidental exposure. Get vaccinated. Get tested for hepatitis during pregnancy or otherwise also. Practice safety hygiene to avoid sexual transmission, use barrier methods and safe methods. Some don'ts. Don't use any personal items of infected person. Don't share razors, toothbrushes, syringes, needles. Don't donate blood if you are infected. Don't drink alcohol. Avoid traveling in infected conditions and also avoid poor sanitary areas. Don't take drugs without prescription, or don't continue the drugs when the doctor gives a prescription. Don't continue them for many days, and when you are using paracetamol, be careful. Don't eat or drink contaminated food and water. As we all know, the liver performs over more than 500 vital functions every single day to keep us alive. So it's very important for us to save this liver from hepatitis. So it's time to take action to realize our dream of making this country free of hepatitis by 2030, and also globally we should make sure that the disease goes by 2030. 3,500 people die from hepatitis B and C infection every day. That is approximately one death in 30 seconds. Over 6,000 people are newly infected with viral hepatitis each day. So it's time for us to take action. We must all come together and take action. We have to test the people very early. We should treat them as early as possible. The vaccination has to be advised to everybody, and most importantly to the newborn baby within 24 hours. And education and campaigning on the prevention of this disease is very, very important. So let's come together and create an awareness on this July 28th on World Hepatitis Day to prevent and to treat and to eradicate this disease from this world by at least 2030. Thank you.